Hello everyone, I'm Kate Steinbeck and it is my pleasure to welcome you to Y's first webinar of our webinar series for 2022. And in fact, I'm going to very soon hand over to two young people from the Y Commission who will be telling us all about the Y Commission, how it developed, what it's done, how they can work with your research and lots of other facts beside. So welcome. And before we start, I always acknowledge the number of universities that are involved in this, and the Western Sydney University, of course, is where the Y Commission was developed. And I acknowledge the traditional owners of the country throughout Australia and recognise their continuing connection to land, waters and culture. And we pay our respects to their elders past, present and emerging. And please feel free to, I'm on the land of the Darug people, and please feel free to put in where you are. I draw your attention, as I do every month, to our fantastic website, which is why.org.au, which we will be referring to later. I know the commissioners will, and we have of interest a community of practice there, where we're encouraging people to become, those who are interested in research in adolescence, to become part of our Y group. So, a few housekeeping things. We'll be muting your microphone, and you can see that if you want to react, ask a question, type a comment, you do that through the chat. And we won't be taking questions in the middle of the presentation. I'll be fielding those questions to our presenters at the end of the session. So reminding you that the chat is up on the left-hand corner, and we are going to be doing a poll later on. I think that's right, Betty. And so please just enter your questions and comments. You can, and I think it's really good that you can re-watch the webinar or read the transcript, and we'll timestamp our questions so you can move through those documents or on screen later on. And so it is now my pleasure to introduce two young people who are working within the Y Commission. I'll explain their roles in a second, which is the group that is our Young People's Co-Research Team. So I'm going to first introduce Betty Nguyen, who's waving to you all. Betty graduated from Western Sydney University with a Bachelor of Law, and she's honours Bachelor of Arts, and has also completed a graduate diploma in legal professional practice from the University of New South Wales. And so she's an admitted lawyer in the Supreme Court of New South Wales, but at the moment, Betty is working as the research assistant for the Y Commission, and in fact, she was one of our original commissioners. So once you join, you're in it for life. Not really, we'll let Betty go when she wants to, but she is certainly so fantastic with her passion about youth engagement and particularly young people's rights. And our second great presenter, I want everyone to say a warm welcome to Jahin Tanvir. Jahin is currently a member of the Y Commission, and he's also undertaking an accelerated Bachelor of Vision Science and Master of Optometry degree with an ambition to work clinically and as a paediatric optometrist, and also adding to a second role of really striving towards being a global health advocate. And Jahin joined the Y Commission because he wants to make sure that young people are heard in research that relates to their overall well-being. And I think many of our audience can relate to that, the importance of the youth voice from the beginning of our research. And I think enough from me. I am going to hand over to Betty and Jahin to present.
Thanks, Kate. So my name is Betty and my pronouns are she, her. And that's Jahin. Jahin, wave. All right, so before we jump into our presentation, I thought we might just go through what is the Y Commission. So the Y Commission is a part of an action research project which has been co-created by young people and is funded by the NHMRC Wellbeing Health and Youth Centre of Research Excellence. Now the Y Commission was created because even though we do have adolescent health research, we know that young people are often not involved in the research process from the very beginning and often are left out in conversations that impact their health and well-being. So our aim is to reinvent teenage healthcare by putting young people's lived experiences at the center of research, policy, and service. So what aren't we? Now, the Y Commission is not a panel provider or a recruitment service for research projects. This means that the Y Commission does not recruit research participants for research projects. And now here's the exciting part. So this is the Y Commission team. Now, the Y Commission in 2019 and 2020, there were 18 commissioners. In 2021, there were 27 commissioners, and this year, excitingly, 24 out of the 27 commissioners are continuing with us. We are currently finalising our new cohort of commissioners in 2022, and these young people are from New South Wales, Victoria, and South Australia. Now, all our commissioners are currently between the age of 14 to 23 and are from the Greater Sydney region. However, with this year's recruitment, we plan to expand into regional, rural areas of New South Wales, Victoria, and South Australia. Now, I have a feeling all of you are wondering, how do we work? So we have onboarding and an induction process, which we offer an online and face-to-face version. We have core workshops on the following topics. So the need for youth participation in youth health research and translation, research methods in the form of research carousels, research ethics, and communicating research. Most importantly, we have Y Commission-led workshops. This means that the Y Commissioners have led workshops on the following topics. So, for example, intersectionality and youth health research, gender and sexuality, diverse and youth health research. The Y Commissioners also work with YCIs, so chief investigators, on advising and collaborating on projects and advocacy, and the Y Commission also consults external entities and projects. So, with that being said, a little bit about me. So, specifically, I am as Kate mentioned, an RA at the Young and Resilient Research Centre, Western Sydney University. But most importantly, I currently support and coordinate the Y Commission. Jahin, would you like to introduce yourself?
Absolutely. Thanks so much, Betty. So I joined up with the Y Commission in 2020. And basically, I joined up because as a young person, I've always wanted to play a part in how we shape health research, in research that affects me as a young person, as somebody who's going through that phase. And when I saw the Y Commission, I was just like, this is perfect. I'm able to elevate my voice, but at the same time, get exposure to the whole research world where, as a young person, sometimes you feel like there's just so much jargon, there's just so much fear involved. And so that was really my first step. And, to this very day, I thank the Y Commission for giving me that platform, for giving me that space to, discover what I want to do. And as Kate very eloquently mentioned, I'm studying optometry, so my passion is always to work with young people, and being involved in so many research projects and different involvements with Betty and the rest of the team. It's been phenomenal, in the whole idea of co-design and the beauty of that when it comes to young people.
Thanks, Jahin. So what we are going to do now is Jahin's going to introduce to us our Y Commission report. And our Y Commission report showcases the cornerstones of youth health research and policy priorities. So, Jahin, would you like to take it away and talk about a little bit about the Y Commission report?
Absolutely. So the Y Commission report is basically giving young people the voice, the platform to express their concerns about health and well-being. In the last 2 years, I don't think I even need to give a background on how it's been like for the world, but particularly with young people and the unique social determinants that they have that affects their lives, there's just been such a dramatic impact on their health, mental health, education, employment. And so the report basically brings all of that research together, first and foremost, with the help of young people and their input. And it really addresses these concerns. We've got health and youth health primarily. We've got research and we've got policies, and there's also a few solutions that the young commission have come up with in terms of addressing these sort of difficulties. So the Y Commission, what we like to sort of characterize is, if you want to know anything about what young people think about their health, this is the report for you.
Yes, thanks, Jahin. So, in terms of methodology, so the Y Commission report is underpinned by Y's engagement framework, youth participatory methods, and co-design. So, over the course of 4 workshops between March and July 2021, which were conducted online and face-to-face, 26 commissioners from the age of 14 to 23 were involved, and during the workshops, we asked the commissioners the following questions. So, number one, what are the youth health priorities from your perspective? And number two, what are the effective ways to work with young people in health, research, and advocacy? Now, the outcome of this was to build a dialogue between the Y commissioners and researchers, as well as a report that we could share more widely. So, most excitingly, Jahin's going to kick us off, and the both of us will go through our 6 health priorities. So, Jahin, take it away.
That I feel like none of us have heard about. I'm only kidding. It's COVID-19. Young people have been impacted with COVID-19, as have the rest of the population, but with such a financial hardship, an emotional hardship on their mental health, and just not being able to find that sense of fulfillment anymore with the world in such an uncertain place. COVID-19 has been at the forefront of everything that we've been doing. For us with the Y Commission, we've completely transferred into the online environment. We've had to do that for safety purposes, but we've still continued the process of doing research, talking about our lived experience, what it's been like in isolation. How have our employment been impacted? How can we better support ourselves and the people around us? So COVID-19 has definitely been the number one health priority, and it's sort of been the umbrella that's cascaded into the other priorities. But it's specifically financial support, financial hurdles that have existed, emotional support, and also moral support when it comes to young people and COVID-19.
Beautiful. Thanks, Jahin. So the next Y Commission health priority is mental health and eating disorders. Now, the Y Commissioners have highlighted the need to prioritize mental health promotion, early intervention, and initiatives to promote help seeking and resourcing to provide treatment for young people with mental health needs. This is particularly important for suicide prevention because the Y Commissioners are concerned that young people are not aware of the services and strategies that they can utilize to get help. The commissioners call for holistic approaches that better unite mental health and physical healthcare throughout young people's healthcare journeys. So that's whether that is in the community or in treatment settings. The commissioners are also concerned about the role of influencers on social media and its impact on young people's expectations of body image, eating habits, and food. And most importantly, the Y Commissioners want a greater focus on the impact of eating disorders on young people in multicultural communities to ensure eating disorders are better understood and not stigmatized by these communities. So, Jahin, take it away.
Priority that the Y Commission has identified is sexual health. And to be more specific, to have more and better educative resources to learn the realities of sex. The beauty of the Y Commission is that we come from very diverse communities. We come from different backgrounds. We come from different geographical areas around Australia. And the reason we've identified sexual health is because that's a massive barrier that exists in many marginalized, underprivileged, and minority communities. So, for instance, a lot of us coming from South Asian and multicultural backgrounds, sexual health is a massive taboo and stigma, and that remains an obstacle when it comes to actually addressing it in a health and research sense. So we've identified this as a priority to focus on and really address on a very community level, so that we can not only communicate the research that's been taken place and to communicate it with the community members, young people, their parents, their guardians, but also break that stigma, because a lot of us have agreed that research and evidence-backed research, most importantly, can change cultures, because that's facts. That's what we've found. So sexual health has definitely been one of the most, paramount areas that we focused on, and especially from underprivileged areas of young people.
All right. So, what does the Y Commission mean when it comes to environments and products? Now, what they mean is that the Y Commission wants environmentally sustainable and youth-friendly spaces which enhance young people's health and well-being. Now, the Y Commissioners want some spaces to be separate from adults, and all built environments should be accessible, safe, appropriate for all young people. Now, coming out of the COVID lockdown, natural and built environments and infrastructures for exercise are so important because these directly impact young people's physical and mental health. Now, the Y Commission has specifically highlighted its importance in low income communities. The commissioners are also concerned about the lack of regulation, allowing poor quality foods, especially fast food and harmful products such as vapes, to be marketed indirectly and directly to young people. They want to prioritize research and policy that focuses on access to healthy, affordable food and to better be protected from harmful products. All right, Jahin.
Is health ethics. And this is definitely one of those topics that initially, as young people, we were just like, okay, what is that? That's just so much jargon. I don't understand. But once we were able to deep dive into what it means, we've understood that young people want to have access to credible and accountable health information. And it's also about research ethics, being more inclusive to young people and enhancing young people's participation in adolescent health research. So basically, making that clear how that young people can get involved. And from a young person's lived experience, I never knew this existed, or this was a paramount issue that we need to take into consideration. So being able to deconstruct that from our time, co-designing and working with different researchers, we've identified that this needs to be more accessible on one regard, but also made more clear so that young people can get involved and more young people can feel more empowered by research, rather than thinking, oh, that's completely out of my reach. So that's the fifth health priority. And over to you, Betty, for the last one.
Thank you. So, most importantly, health information and health education. So, the Y Commission is calling for health information and education to be youth centered. This is because the Y Commission believes that health information is often presented from an adult's perspective and is not very engaging for young people. The Y Commission value transparent and accountable health information, healthcare. They want to use this information to inform their decision making whilst retaining their sense of agency and autonomy. And most importantly, the Y Commission wants to make health information education more fun, engaging, and they hope to see health information to be co-designed with young people for young people. And most importantly, the information needs to be translated into a product that young people can actually relate and understand. So, those are our 6 health priorities. We are going to move on to our research and policy priorities. So, Jahin, would you like to talk about the social determinants of health?
When it comes to research and policy, because this is affecting young people directly every single day. So the number one is social determinants of health. really taking a more holistic approach and considering all aspects of young people's health and well-being. So being able to identify, okay, if you're living in a marginalized community or an underprivileged, low socioeconomic community, there's certain determinants, social determinants that will affect you. How do we take that into the consideration and conversation? Whereas if you're living in another area or a geographical location, there's obviously different social determinants in that sense. So how do we bring that together? And as young people coming from diverse backgrounds, as I mentioned, that's the beauty of the Y Commission. We come from such diverse and respective backgrounds. We're able to bring that together and also have that holistic conversation that social determinants affect us in unique ways. We need to address all of them to have research empower us instead of saying, okay, you're part of that social determinant, that's affecting you. Let's not look at that. The whole idea of deviating away from the one shoe size fits all mentality to one that we consider and address every concern that young people may have.
Beautiful. Thanks, Jahin. So the next one that the Y Commission has identified is discourse. So what the Y Commission means by that is that they've identified certain labels and language, so for example, child or adolescent, that constructs young people as risk takers, are irresponsible, and are a problem to society. Now, it doesn't help when a lot of health professionals and researchers think that young people are misinformed or misguided by their decisions that they make in life. Ultimately, what the Y Commission is saying is that young people want to feel respected and want health professionals to use language that is specific and inclusive to their needs, interests, and life experiences. The Y Commission wants to address stigma, in particular the stigma of youth, and help seeking to address the power imbalances that exist in young people and adults in health research and policy making. The Y Commission has provided an example of a term that they like. So the commissioners prefer the term young people to adolescents because to them it's more inclusive and it opens up conversations about health and well-being within their communities. Most importantly, it doesn't limit young people's capacities or create assumptions about them. What young people really want is authentic communication that values their lived experiences so that an equitable health future can be created for all young people. Jahin?
Research and policy priorities, accessibility. So in the last 2 years, we've seen a major shift from face-to-face to online telehealth services, health services taking place due to the unforeseen factors. And as good as those services are, there's a lot of communities of young people from regional, rural, remote Australia who don't have access to these services because of technological differences, not having access to the internet. And these are points that we had to raise and take into consideration. So to make accessibility more paramount, we needed to have more accessible resources and services. And similar to other communities that we mentioned before, multicultural communities, there's massive barriers when it comes to accessibility to psychologists, for instance. There's a lot of young people that mention that they don't know how to speak to a psychologist, or where do I go to contact a psychologist? How does my Medicare work when it comes to psychologists? So all these different factors that come into place, and it's just about educating them and being there to raise awareness and overall improving accessibility for different areas of young people. Not just one shoe size fits all, but the idea that we address young people from different diverse backgrounds.
All right. So, in terms of diversity, the Y Commission wants greater cultural sensitivity and diversity amongst health professionals, health services, and health information to reflect the complexities of young people's lived experiences. The Y Commission has said that there is a positive impact of having clinicians who are of similar background because they feel like they can empathize with them more and that they can relate to young people's diverse experiences. And most importantly, uh, the Y Commission would want all young people to be represented in narratives about young people's health and well-being. They are calling for greater representation from young people from culturally and linguistically diverse backgrounds, refugee and immigrant backgrounds, low socioeconomic backgrounds, LGBTQIA plus backgrounds, Aboriginal or Torres Strait Islander backgrounds, young people who have experiences with stable housing or homelessness, young people who have experiences with or have a disability, and young people from rural, regional, or remote areas. What the Y Commission wants is they're calling for better training, youth-friendly health information, and awareness of cultural diversity and backgrounds amongst health professionals and organisations, so that young people's needs and their intersectionalities are reflected in the care and information that they receive. Now, it's most important to include young people's peer and community networks in conversations about health and well-being and their healthcare, because it creates greater cross-cultural and intergenerational trust in health services that young people access. All right, Jahin.
That brings all of our priorities essentially together is participation. We wouldn't have a Y Commission if young people didn't participate or were like-minded and wanted to get involved. So our last priority was to have dedicated spaces for young people when it comes to co-design, when it comes to research, when it comes to having conversation with academics. We want that barrier to be as broken up as possible so it becomes accessible, that young people can have conversations with researchers to break those jargon that exists and, increase accessibility essentially. So having young people part of dedicated spaces like the Y Commission, like what we're doing with the Centre of Research Excellence, being able to have conversations, being able to bring young people. Betty and I were part of the recruitment process that we're bringing, young people from all around Australia together with the common good and common goal of, pushing the agenda to have young people involved in research. Young people do want to be part of research, and it's just about giving them the dedicated spaces. And so that's been one of the main areas that we've identified.
Thanks, Jahin. So those are our research and policy priorities. So in terms of principles, Jahin, would you like to talk about these principles, since these principles are what the Y Commission has come up with? So before Jahin just jumps in, I just want to frame that the Y Commission's principles are things to help guide health research and conversations with young people. So Jahin, take it away.
Principles that the Y Commission came up with, discussions and conversations with one another, and the whole idea of co-design. So number one is holistic approaches. So again, taking a more macro viewpoint rather than minor micro ones when it comes to identifying health challenges and how we can better identify them. So again, taking that perspective, authentic and respect. Again, whenever we're dealing with each other as young people, when we're dealing with researchers, academics, when we're dealing with different stakeholders, it's just about being authentic. It's about being showing respect and identifying we're all here for the same common goal. And so the respect should boil down from there. And young people, we expect that whenever we're conversating with one another and also different stakeholders. The third one is autonomy and agency. Young people want to feel liberated. They want to feel like they're feeling empowered when it comes to research. So that comes with, giving them the space. That comes with the whole idea that, young people have so much to say. It's just about giving them a platform to speak on the issues that are involved. And, the beauty of co-design is that's exactly what it's there for, being there to give them autonomy and agency. Number 4 is diversity and inclusiveness, as Betty beautifully mentioned. We come from so many different backgrounds, so many different age groups, different degrees. I don't think there's 2 people in the Y Commission that share the same degree. And that's the beauty of it. We get to contribute to health research from different perspectives, different social determinants, and different interests. And it just comes together because at the end of the day, we're brought together by being young and also being able to mentor and teach one another our experiences. And at the end of the day, push that agenda that young people need to be part of the health research agendas and the whole process of, research for young people. Because if you're researching about young people, why not empower them and get them part of the process? And the second last one is integration and innovation. When it comes to young people, we're always trying to find out different ideas. Betty would know for every meeting that we've had, we have so many sticky notes around the wall. We have so many ideas, and it's just about making it accessible, making it digestible, and making it inclusive so that we can integrate these ideas and innovate as much as possible with these ideas, and just make research accessible for young people so that they can understand it. There's no, communication barrier, and we can have a very constructive and productive dialogue and how we move these agendas of ours and goals and things forward. And finally, the final principle is accountability. The beauty of having young people and researchers together is that we can hold each other accountable. So whenever young people, we feel like researchers need to do more, we have that conversation. We say, hey, I'd love for you to speak to us on this matter, or let's talk about the healthcare sector, or let's talk about COVID-19 and how it's impacting employment, for instance. And similar way, works both ways. Researchers can say, hey, we need more young people part of the process. We need, if you want your voices to be heard, we need more young people from, South Australia, Queensland, as we've done when we were expanding the Y Commission. So just about holding each other accountable, and then, making very productive leaps forward in our common goal for, health agency and health research in general.
So Jahin, do you want to also go through the recommendations?
Absolutely. And so when it comes to young people, we love action-oriented causes. So a few of the recommendations that we've come up with as a group, as a team, is number one, partnerships. We want to work and have partnerships with other organizations. We can't move silently. We can't move alone. There's no power. There's no prowess in that. So being able to collaborate, build relationships, build meaningful partnerships that want to empower young people, that's definitely been a step that we're taking. Young people's networks. There's obviously a lot of young people, youth organizations in Sydney, in Melbourne, around Australia, and we want to work with them. Oftentimes, especially in the last 2 years, a lot of these organizations have a shared mutual goal of health and well-being. And as people in health research at the Y Commission, what better way to push that forward and help that that cause be elevated if not working with people who want to have the same goal in mind? So young people's networks, building that networks, building meaningful connections. Again, it's great to have some organization's name on a pamphlet or on an event, but why are they there? What are they contributing? How are we working together? So making that very clear. So that's been a very critical recommendation from us. Cultural awareness and cultural competency. We work from, again, diverse communities, diverse backgrounds. There's unique social determinants everywhere. And so just having that cultural awareness, whether that be through training, through more conversations between young people from different areas, different organizations, building that cultural awareness. It's integral, especially in this day and age where inclusion is so important. The fourth one is capacity building. So continuously upskilling, continuously having new innovations. Young people want to get involved. We're very ambitious human beings. If you have met the Y Commission face to face or on an online platform, you'll know we have so many ideas, and so we constantly want to build and create. And so giving them the platform of capacity building. The second last one is shared language. Ensuring there's no jargon, ensuring that there's no miscommunication, ensuring that the language is accessible. A lot of the times, and a lot of the fears that I had, for instance, when I first joined the Y Commission, was just like, how do I understand research? I'm this 18-year-old kid who just wants to volunteer and get involved. I don't understand research. And so having that shared language where researchers can come and say, hey, I understand this might sound, a little daunting, but this is what it means. And then we build that conversation and we go from there. And the more we learn as young people, we can sort of teach and share the wisdom with the newer recruits for the Y Commission and go from there. And, shift that culture of that research isn't scary. It's just not, taught in the way that we understand. So making it more accessible, sharing the language, and also, sharing the language with different communities as well, which is, again, very important. And finally, the recommendation that we have is streamlining information. So making it, again, the word that I continuously use that I love using is accessibility, ensuring that we have transparency in the research and information that young people are receiving, in the research that the researchers are receiving, the academics are receiving. We want it to be transparent. We want it to be taking a holistic approach and understanding that this is what we're doing. It's clear and concise. And if it's not clear, we won't have actions that are being taken. So ensuring that everybody is on the same page and understanding, and that again comes with more collaborations, partnerships, conversations. But those are the main recommendations that we came up with. They're more into detail in the report, which if anybody wants to read more about, please feel free to do so. This is just more of a summarized, but those are the recommendations that the Y Commission have come up with.
Thanks, Jahin. So, more exciting part. So, how can the Y Commission get involved with your research? So, there are 4 areas in which the Y Commission can be involved in terms of your research. And these are drawn from our 4 pillars, which are research, advise, and co-create. And this extends to research and translation. Capacity building, which extends to young people and other researchers and also beyond. And advocacy and policy. Now, in terms of these areas, I will give you a bit of a rundown on what the Y Commission can do for your research. So the first area, obviously, is research. So the Y Commission can be involved in the research process and can help you at the data collection, analysis, or research translation phase. So, for example, the Y Commission has worked with Dr. Teresa Swift on her Emerging Technologies Literature Review and her Future Scenarios project. In particular, a Y Commissioner translated some of her research findings into these beautiful images. So that's one option that is available. In terms of advice and co-create, the Y Commission can give feedback on your research project wherever you are in terms of the research phase. The Y Commission can also assist in co-designing resources to promote working with young people in research. So for example, the Y Commission has worked with chief investigators on new project proposals. So for example, the Synergy Grant. In terms of capacity building, the Y Commission can offer mentoring and currently we are in the process of developing a toolkit, so watch out for this space. And the Y Commission can also help support you to conduct participatory, collaborative, and youth-led research and in the form of living lab workshops, which are co-designed and co-facilitated with our Y Commissioners. And lastly, in terms of advocacy and policy, this refers to translating research through research projects, including developing materials for youth and policymakers to promote your research findings. So, for example, the Y Commission has advised the Australian Institute of Health and Welfare on indicators for Australia's youth 2021 report, and were commissioned to write topic pieces for the report. And Jahin is actually a contributor to that report, which is very exciting. In terms of another example, the Y Commission has also made submissions to the Australian government and international bodies such as the UNCRC and opinion pieces for the conversation on young people and COVID-19. And so that brings us towards the end of our presentation, but we thought we could do a bit of a poll in terms of who's actually interested in working with the Y Commission. So if we can, I am going to share a poll. If you can vote which option, so at the moment the question is, now that you know about the Y Commission, how likely are you to get in touch? So your options are, you'll be hearing from me ASAP, sounds good but no immediate plans, or not at all likely, which is fine. We won't get upset if you left that answer. All right, beautiful. So in terms of our presentation, I'd like to conclude it with a quote from a commissioner, which is, let's bridge the divide between adults and adolescents and make the discussions about healthcare less daunting. And so that concludes our little presentation. I am going to share the Y Commission report with everyone. So if you would like to read further and dive down into specific points, there's the Y Commission report available. You can contact me via my email, check out our Instagram, which is actually led by the Y Commissioners. So check that out and follow us on Twitter. So thank you, everyone. That concludes our presentation. And now for the questions. This is the most exciting part.
Thank you, Betty and Jahin. We are so proud of the Y Commission, and speaking on behalf of the investigators. When we thought about developing a Y Commission, I don't think in our wildest dreams we really envisaged how it would turn out, who would come and want to be part of it, and it truly has become, I think, very, very central to the whole of our CRE. And even if the CRE is not continued to be funded, because research is often very difficult as far as funding, we certainly have other ways to look at making the Commission continue. So I'm now going to have a look at the chat. Now I want questions now. Where are we? Okie doke. Right. I'm going to give you the first question, which comes from Kristen. And Kristen says, thank you so much for a fantastic presentation. I think we'll all second that. You are both so inspiring. How does your lived experience inform your approach to your role as the Commissioner? I'm very keen to hear about intersectional identities and marginalised identities. How do you effectively communicate this to researchers? What are your experiences of working with researchers who also may have lived experience of a marginalised identity? That is about 4 questions, I think. You can pick what you wish to answer. So off you go.
Could speak.
Yeah, go for it.
Good.
I think for me, my lived experience is honestly everything when it comes to informing research, not only as a young person. So I recently just turned 21, so I fall into the category of young people, but also coming from, my identity, being a first generation migrant, growing up in Australia, trying to understand the language, how to inform health decisions. So whenever we have consultations or discussions, that's always the first point that I bring up, where this is where I come from. Now let's talk about it, because systematically there's a lot of disadvantages that exist for marginalized communities, underprivileged communities, minority communities, and bringing that to the conversation and making that aware of maybe the privilege that a lot of us are in compared to marginalized communities, I think is a massive area that I always try to bring in with my lived experience. The intersectionality between identities and health is it's integral to how we speak. And so being able to communicate that with researchers is just having a very honest conversation, instead of thinking that this is a disadvantage, this is where I'm so different compared to everyone else, seeing that as a point of empowerment, saying that, okay, I'm different, but this could be valuable for research. This could be valuable for this many young people who may be coming from similar backgrounds, multicultural communities, CALD communities. And so just reframing your mindset and being able to say, okay, this is empowering. Let me communicate. Let me be authentic. Let me open up. And in that way, I think Betty can also agree that once we are more transparent, once we are more authentic, other Y commissioners, they find that empowering and liberating themselves. And then they start opening up. And then we start having this very beautiful discussion between researchers, academics, young people. And so it just requires someone to open up and just talking about their identity first and foremost and how research affects them. And then everybody, has that beautiful conversation.
Thank you. That was a really great answer, but I'm going to ask you one more question, because I'm not certain that everyone online will understand the concept of intersectionality, because I often get asked about that myself. I'm wondering if, because it is somewhat relevant here, I'm wondering if you could explain that as a young person, as a Y Commissioner, how you see intersectionality.
Absolutely. So intersectionality as a young person being involved in research is basically how everything ties together. So you can't, expect to have great health if you're systematically disadvantaged in the geographical location you're at, or, the color of your skin or your identity. There's obviously different factors that affect health. Health is not just, an umbrella term that everybody has the same opportunities. So when you talk about intersectionality, it's just about how different factors impact us. So, for instance, your education, if you go to a private school or a public school, there's always that debate of that does that improve your health choices or your financial decisions. If you come from a different background, if you're first generation migrant or you were born here, are your cultural interpretations different to how you inform health decisions? So just bringing all of that together into the discussion instead of just saying, okay, health is health, but health is much more than that. It's such a umbrella term that has different factors involved. So just bring those different perspectives into the conversation and not just limiting it to the absence of disease. From what I've learned in university, it's not just the absence of disease, it's more so the different factors, the social determinants that impact us, and as researchers being able to take that into consideration as well.
Thank you. We're going to move on, and I'm out of practice managing this, so the next one is the next question comes from Karen. And do you only get involved with major clinical and university-led research? We will have a small local peer mental health worker pilot project happening and would love some input. Very practical question.
So, as I mentioned earlier, when I was talking about the options on how to involve the Y Commission, so previously we've worked with the Australian Institute of Health and Welfare. So it's not necessarily major clinical and university-led research. We are also interested in working with external entities and projects as well. And I would love to hear more about your small local peer mental health project. If you could email me, that'd be awesome.
Now, I think that's a really good point, because we often think of research as just belonging in universities with professors who possibly are out of touch with the world, and the importance of looking at research often starts in a way of just seeking to make something better for someone else's health and well-being, and how to do that in a systematic way, and a way that will get answers that are useful and practical, and may lead on to more research. Now, I've got another one for you to answer from James, who says, what have you noticed are some of the barriers to researchers and policymakers, often older people, taking your views seriously? You've both probably had some lived experience of that.
Jahin, do you want to go first and talk about your experiences as a Y Commissioner, and then I'll talk about my experiences as a youth peer researcher?
Absolutely. I think the first thing that comes to my mind as the one that I can't get rid of is oftentimes we have these consultations and these meetings with young people, and that's fantastic. But what's the outcome? Like, where does that go? And I think as young people, that's always been a bit of a barrier for us, because we want to get involved, we want to be part of the process, but oftentimes we don't see where that leads to. Like, does it go to a report? Do we ever see the report? Does it, inform government decisions? Does it inform universities? We never really see the outcome. It's always come to consultation, we're empowering your voices, but there's never any action-oriented, output-based response from what we've seen. And so that's always been a barrier in terms of motivation to attend these co-design or working with researchers. And what the Y Commission does fantastic is, we have a report. We have a report at the end of the day that we've worked on for years based, or even more years before that, that all informs the decision. So we're seeing that. And that's why, there's so many people that want to join the Y Commission. So if more researchers want to get involved in the youth and adolescent sphere, tell young people what they're contributing to. They want to feel like they're working towards a greater cause. They want to feel the energy of, their value. And in that way, they'll feel empowered. And, that barrier of why am I here will completely be negated. And you'll have some fantastic evidence-backed research and discussion. So again, having the output-based response is very clear and concise. And, that's, I think, the only barrier that I see when it comes to this.
Have you experienced having to ask a researcher as to what they intend to do and how they'll involve you?
Oh, many times
Right.
in the past where I've just been like, great, it's here, the session's finished, but what happens next? I've
And
had to follow up sometimes via email after like a few months to say, hey, I remember doing that consultation once. Has that come into fruition? Has it informed any decision? Most of the times you don't hear back, but sometimes you hear back and you get a report or so. But we shouldn't really be asking if we were part of the process. We'd love to like be part of the entire process till the end.
that's a somewhat distressing reply to hear. It's so easy to just ignore emails that you don't want to answer because maybe you don't have a good answer to them. But certainly, I think that's something that we as researchers who understand that research is not just about one part of research, it's all the way from the co-design to finally translating what we find into the words that young people will understand. I think that's been very useful, useful to hear because it's sad. Now,
Kate, can I just add in something on the previous question
yes.
before we move on? So I had the unique experience of being a youth peer researcher. What that means is that I was a young person who had research skills and then also became a research assistant as well. And one of the things that I've noticed as a barrier is language. Now, what I mean by language is certain phrases or words that young people use, researchers may not use. And so there's always this disconnect between researchers, policymakers, and young people. And this is a barrier because what happens is young people will use certain terms to describe their lived experiences, and then researchers may misinterpret that. So I think it's really important to establish a shared language between researchers and young people and policymakers so that we are all on the same page.
Betty, does an example come to mind as you're talking about that?
For me, the term youth health service or youth health services. So young people will use the term youth health services to describe services that they get in contact with. But from my understanding, youth health services in like a health or a government context is completely different.
Yes, it can. Yes, it's for a certain group of young people only. Yes. No, and that's a very clear example actually, because why should we think that something sounds very generalist is in fact, according to government policy and funding, quite specific? Thank you, Betty and Jahin, for that. Now, next question is, the Y Commission is amazing. Oh, hang on, sorry. I've flipped that off the screen and I can't get it back again. So I'm going to read it out. The Y Commission is amazing, and I think that all states and territories should be able to stand up similar entities as health systems are diverse across the nation. But so many of the barriers are the same regardless of geographical location. And I think they probably did miss it when you were speaking about it, but the questioner is asking, do you have youth representatives from across Australia? And perhaps you'd like to reply to that because it's one of your new initiatives for the year.
So I can answer that in two parts, Browner. So one part is this year we're recruiting Y Commissioners in New South Wales, regional and remote areas, specifically South Australia and Victoria. But most importantly, we plan to roll out this current Y Commission report and scale it up to a national level. So we plan to have a look at young people's national priorities. So watch this space.
Very exciting. And don't forget Queensland and
Yes.
Western Australia. We're such a diverse sort of country in a way, particularly the size of many of our states. Now, I can't see another question on the line, but I actually have a couple of questions for you, and that's which I haven't written down. But if researchers are to become involved with young people as co-researchers, how soon would you like to be involved? Where, at what stage? Because I think a lot of research is researchers respond to research calls, which are often quite quick. So are you in a position to also respond quickly if researchers want to involve you right from the beginning when they're actually designing their project? And there might not be a lot of time. Maybe the sound disappeared, did it?
With the whole experience of being a Y Commission and also part of the process.
So in terms of being, well, it's kind of interesting because I play two roles in the sense that when I started with the Y Commission, I was a young person, but now I've sadly aged out and I'm becoming an older young person. But I think because I have that lived experience, it makes my job to support and coordinate the Y Commission a lot easier because I understand how to kind of bridge that gap between researchers and young people more easily. So in terms of that, that's how I would answer it. But Kate, was there any other parts that
Look,
you'd
I
like me to
think it
specifically
might
answer?
be helpful if we go to a question that might clarify it a little bit.
Yes.
And this is from Ian, who says, "Thank you very much for insights and ideas. Could you possibly talk through a practical example of when representatives from the Y Commission worked with a research team on a specific project?"
Okay. So one of my favorite examples when the Y Commission has worked with a specific research, I would say, project is when the Y Commission contributed to the Australian Institute of Health and Welfare, that report. So the Y Commission had input into that report and specifically the indicators of that report. And the Y Commission themselves actually authored opinion pieces about topics that they were really passionate and interested in. And actually, Jahin could talk about a little bit about his experience of authoring that opinion piece as well.
With another Y Commissioner on young people and discrimination and how that affects their health and overall well-being. And it was a fantastic process, just being able to not only being given a Google document to just put our thoughts in as much as possible with someone obviously editing and helping us out. But when I looked at the final sort of copy of what we said in the report, I'd say 98% of what we said was in the report. So having that transparency and that streamlined information of what we thought our lived experience was, how we want to change, or what our recommendations was, and to have that entire, section and paragraph in the report itself without any, censorship or editing, that was fantastic. Just being able to identify that, okay, our lived experience is important, it is valued. And so, that was one of the examples. And the whole process was fantastic. We were able to just have a consultation and actually speak with our minds and our lived experience. So yeah, it was a very streamlined process, and being able to see the end outcome, as we mentioned, an output-driven outcome, it was fantastic.
I think in a way you've answered the question. You really want to get involved from the beginning and to see your thoughts and your considerations of the research be built into that research grant. Perhaps if I'm not putting words into your mouth, I'm going to have to finish this now. Somebody's just asked, when will you go international? I don't think we hope to do that in the end. The world is a big place, but I think we might aim to go there. Look, I want to thank Betty and Jahin for just a fantastic presentation. You've got contacts that you can get in touch and ask more questions. And I am going to pull this session to a close, even though I suspect we could talk for another 30 minutes or so. So thank you again. Thank you to our presenters, and thank you to a fabulous audience.